Your health tonight, live in the newsroom, and a severe surge of the flu now blamed for the deaths of 4 children here in Massachusetts, including 2 in Boston. City officials say that both were under the age of 2. Joining us right now is Dr. Todd Halloran, Chief of Infectious Diseases at South Shore Health. I mean, that just breaks my heart, and I can't even imagine the nightmare those parents are going through.
Right.
It's so sad.
Yep.
It is so tragic. But as a physician, it's insensitive to ask the question this way, but is that rare? Are the numbers low and rare?
Thankfully, it is rare, Eddie. But although last year we saw about 280 deaths in the U.S. for that year, and that was the most in over 15 years. There were 10 deaths in Massachusetts, just to put into perspective, 4 so far. 2 of the children we know were under 2 years of age, and we know that 6 months to 2 years of age is a really high risk group. Those are really what you want to focus on for vaccine.
We've had this conversation before, and you've said that this year's flu shot is really not a good match for the flu that is circulating right now. Is that part of the problem?
It is part of the problem, but remember, even when it's not a good match, you're going to see, you may get the vaccine and get the flu. We know that's going to happen, but it still decreases your risk of emergency department visits,
right,
hospitalizations, and we know they've proven that in the UK.
Yeah.
It also is going to decrease your risk of death. We know that when pediatric kids die of influenza, 80 to 90% of them have not been vaccinated.
80 to 90%.
I want to emphasize that point. So if you're a parent and you're worried that your kid could die of influenza, even though it's rare,
right,
we have an antidote for that, which is the vaccine.
We know that a lot of people are skipping the shot anyway. Rates are low in every age group, and usually Massachusetts is high on these things. But as you see on the screen, what, 38.8%, just about 39% of children under 5 have gotten the flu vaccine so far. 5 years ago, that number was over 60%. What's your reaction to that?
I'm really concerned. It's not just in the younger age group, it's every age group. Even when you look at the over 80 age group, that's on the decrease as well. I think there's a ton of vaccine skepticism, as you know. COVID has made that worse. It didn't just start. Right. You're seeing a real trend. Right. And I'm concerned that it's not just about not getting the flu vaccine, but not getting the flu vaccine, how does that spiral into other vaccines as well?
Sure. What is this? Are we at the peak of the flu season right now, or do we still have more to look forward to?
You know my answer on that.
Yeah,
if I knew the answer, I'd be in Vegas right now.
Right,
okay?
right.
I do not know. The one thing that's clear, remember, there's a saying that if you've seen one flu season, you've only seen one flu season. It's just so unpredictable. We don't know if we've peaked yet.
Dr. Halloran, great to see you.
Good to see you.
Thank you so much, Maria.